All right. Welcome back, everyone. We are now going to get started with some updates. And I was trying to see if Ray or Deb was on the call. Not seeing them. So, Laura, I don't know if you are able to provide any of the updates from the state about summer EBT or the ESAP. Um, so I'll turn it over to you if you have any
Sure.
updates.
Uh, we met with the Department of Health and Human Services 2 weeks ago. Was it Tiffany? And they said that summer EBT had not yet been approved by USDA, but that they had made all the changes they needed in their software to be able to get out the benefits as soon as USDA approved their plan. Um, And so that's exciting because you'll remember in past years, the benefits haven't gone out off until the winter or later because of software issues. So that's exciting. And hopefully USDA hasn't been cut so substantially that it will take forever. Most other states have been approved. So I think they're just like two states. And maybe by now they have been approved. I hope so. But we will be pushing out any information about the program that DHHS will be sharing. And so please follow us on social media, go to our website. Also, the Elderly Simplified Application Project, for those of you who are unfamiliar, is a set of waivers that's available that would allow the state to extend recertification periods for SNAP from 6 or 12 months to 3 years for people over 60 and for people living with disabilities. And so we have heard from our neighbor states that implementing the Elderly Simplified Application Project is a really good way to incentivize people in those categories to apply for SNAP. And in New Hampshire, those groups are really under enrolled. New Hampshire has the third worst uh, sign up for SNAP by eligible older adults in the country. So the program is supposed to be implemented on July 1st. Not everyone who's eligible will and currently on the program will be enrolled in the Elderly Simplified Application Project immediately. They will phase it in as people reach their recertification date in the next year. So all very exciting. And just to say, they're making the whole process a lot easier. So it's not just that the recertification period will extend, but also that when the recertification is sent to people, it's pre-populated. All they have to do is sign it and return it if their income hasn't changed. So that's really good news because when people, can't upload the right information for recertification, they often get thrown off the program for a month or two, which of course increases food insecurity. So we're really hoping that will decrease the churn rate, churning on and off the program. And we will certainly be getting the word out to all of you to share with everybody you know who might be eligible to apply for SNAP. So yeah, that's the update on those two things. Thanks.
Thanks, Laura.
Any
Do you
questions?
mind sharing any SNAP coalition updates as well?
Oh, sure. I mean, mostly we talked at the SNAP Coalition about those updates and what um, and also about changes at the federal level, potential changes at the federal level. I think probably everybody knows that pretty significant SNAP cuts are contemplated at the federal level, a lot of cost shifting to states. Currently, SNAP benefits are 100% federal, and the state and the federal government pay half of the administration costs, and the proposals are changing that ratio so that states have to pay more of the actual benefits. It's going to be tied to their error rates. So the error rate for SNAP is when people are overpaid or underpaid. And that is measured. And so we're not exactly sure what the cost share will be for the state, but it could be anywhere from 5 to 25% as we understand it. So, and that's really, really substantial. That's anywhere from $8 to $38 million in New Hampshire. And I think given the current budget situation, it's very unlikely that New Hampshire would come up with those dollars, which would mean substantial cuts for SNAP. And then the administrative costs will also be raised to 75% instead of 50-50. So the state has to pay 75%, which in New Hampshire is 5 point something million dollars. And also we wonder what happens if the state chooses not to pay the administrative cost. What does that mean? Can they not run the program? So there's a lot to be worried about, unfortunately. There was a moment when we thought that the Senate parliamentarian was going to save us from the downshift of costs, but the majorities in the Senate were able to reword in a way that means the bill is going forward. We have heard that the Senate is going to vote on Thursday.
Thank you, Laura.
Do you want to talk
Um,
about the sign-on letter, Laura?
Oh, yes, I'm sorry. We have written a sign-on letter to Governor Ayotte to ask her to reach out to, you'll remember she was a senator, to reach out to her Senate colleagues to oppose this, and her colleagues in the other house, because we want to make sure she understands how devastating this would be for New Hampshire. I think she's well aware of the Medicaid ramifications, but not so much for SNAP. So, Tiffany, can we put the link in the chat to the letter if your organization hasn't already signed on?
Tis already there, Laura.
Okay, sorry. Thank you. You're way ahead of me as usual.
all right, thank you so much. Next, I believe I don't think anyone from the food bank is on the call, but just so you're aware, there's a SNAP outreach workshop coming up on July 9th, and there's a link to register there. And then, as always, you can use that SNAP outreach partner link to request any outreach materials for SNAP as well, or contact Heidi Johnson at the email below. And then next, we'll move to child nutrition updates. I don't believe anyone from the state WIC team is here at the moment, but just they wanted to share that August 1st to the 7th is National WIC Breastfeeding Week. And if you visit the DHHS WIC Community Partners page, you can find some of the different local agency celebrations happening. And I will now turn it over to Trisha to share the rest of the child nutrition updates.
Thanks, Tara. Yeah, so for summer nutrition, the New Hampshire Food Bank has posted their locations. It's linked in here. The USDA, their Sun Meals site finder has not yet been updated for New Hampshire. So we have reached out to our contacts to try and get that updated, but we don't have a date. So what we've discovered is social media is the best way to find resources for Sun Meals other than the New Hampshire Food Bank sites. And then for our school breakfast challenge, we're just continuing wrapping up for 24 and 25 school year. And we're planning for next year. There's a link if you are a school, if you work with a school, have any contacts with a school, and would like to have more information, I will put my email in the chat. But if you are a school and you would like to sign on, there is a Google form linked in this slide. And that's about it for updates.
Thanks, Trisha. Um, so here are the different local and statewide coalition meetings um, happening all throughout the month. If you aren't already connected to a coalition, you can use some of the links here, or if you reach out to Tiffany, I'm sure, or there's an email sign up form so you can get some of the meeting invitation and updates as they come about. She's going to share that in the chat. Awesome. And I will now pass it over to Gary to give updates on the New Hampshire Care Connections.
Hi, everyone. My name is Gary Blevin. I'm the Regional Engagement Coordinator with Granite United Way. I wanted to share a new resource that Unite Us is providing for the state. It's a New Hampshire Care Connections Public Resource Directory. It is similar to 211 in that you have the ability um, to find resources based on your location. However, it's different in that 211 gets their information directly from the agencies that they partner with, whereas this information, I believe, is taken from the internet. So it is something that is forward-facing for clients, excuse me, not clients, for the public at large, whereas the closed-loop referral system is for agencies to use on behalf of the clients that they're serving. If you would move to the next slide, please. So they've done a comparison between the closed loop referral platform and this public resource directory. As you can see, it's a lot of things are similar. The primary difference being which direction the program is facing, either to the client or to the public. Additionally, referrals cannot be sent via the public resource directory. It's meant for information only. It does give what I liken to a rack card as far as information is concerned for the agencies that are on the site. So you'll see the services they provide, their location, phone number, fees, if any exist, and the like. If you would move to the next slide. Next is the New Hampshire Care Connections, which I think that between Brittany and myself, Brittany Bowles being my project partner, have talked about at great length. For anyone that is interested in learning more, you're certainly welcome to connect with myself or Brittany. I'll put our email addresses in the chat. And if you move to the next slide, I think it's just another one for Unite Us. Yeah, if you'd like to join, you have the opportunity to connect with that link directly to Unite Us. And I think that wraps up my bit.
Thank you so much, Gary, for sharing. And I will pause to see if anyone has any other updates they want to share with the group. You're welcome to put it in the chat or come off mute.
Well, I put in the chat that the Welcoming New Hampshire July table meeting is going to be July 10th from 9 to 11 a.m. via Zoom. We're going to have the legal director for ACLU, Gilles Bissonnette, speaking about the current situation with immigration and the administration's deportation emphasis. So which should be pretty interesting. If you're not on my email list, just email me, dholt@miracoalition.org to get added to the list.
Thanks, David. Anyone else have anything they want to share? All right, seeing nothing and hearing nothing. So next, I believe, is policy updates. So I'll pass it over to Tiffany.
Awesome. Thanks so much. So I'll walk you through the policy updates that we have on both state and federal. Laura alluded to some, but I'll give you also some other actions that you can take here. So this is just a reminder of our 2025 policy priorities to connect people, mostly school children, to the grid through these different policy initiatives. I'll tell you, if you've been following along, it's been a sort of a rough process, but I want to orient you to where we are currently so that you can get a sense as I'm giving you updates. Just a quick overview of the legislative process. Legislation has started out in either the House or the Senate and gone through committees and the floor votes and maybe finance if there's some money attached to it, and then crossed over already to the other body that it didn't start in and gone through the whole process in the second body as well. And then committees of conference have already occurred over the past 2 weeks. And now we're getting ready for the House and Senate to put their final confirmation on all of the bills after the committee of conference and send them to the governor for her final signature. So that's just like a general sense of here is where we are at the moment. The bill positions, we have either support or oppose, you'll see. So we have some, so we can help you orient to what we're looking at here. And I've added, this is a new addition, a key to tell you, you'll see it at the bottom of each of the pages to tell you sort of the results within each step of the legislative process. So we're going to start off with SB 204. This bill, SB 204, was a bill that would have increased eligibility for free school meals up to 200% of the federal poverty level and split the cost between the state and schools. So this bill was passed through the Senate with flying colors quite easily and crossed over to the House, where the House Education Funding Committee retained it, which is good news because they did not take a stance on the bill and allowed us to advocate to have it added either to the budget or another bill as a non-germane amendment, which was able to happen with HB 143, as you see down here. However, in the bargaining process that happens during committees of conference, it was removed by the committee. And therefore, this particular policy, as it was written, is not moving forward to the governor's desk to be signed. So there's no action at all needed for this particular bill. There is no more advocacy to be had for that bill. Medicaid direct certification started off as its own independent bill, and that bill unfortunately failed in the House and wasn't able to move forward in the House. So it was introduced as an amendment to the budget, HB 2, and through the House Finance Division 3 committee, which it failed through that process, but became terribly close in a vote 181 to 182. It was then introduced into the Senate Finance Committee and voted down by the committee, unfortunately, due to some misinformation about whether or not we could just add a checkbox to the Medicaid form for people while they're signing up, and whether or not that would reduce the need for an application. So unfortunately, the state is not able to share data with schools about who's eligible for school meals without a data sharing agreement in place, which is why the state needs to participate in the Medicaid direct certification program at the federal level in order to make this policy happen. So unfortunately, this is not going to move forward any further in this legislative session. And this bill, I apologize, I didn't explain what it is, but automatically enrolls children in free and reduced meals who are eligible and whose family is already enrolled on Medicaid without another application. So currently, you have to fill out a Medicaid application and a school meal application separately and turn in the paperwork twice and do all of that authorization process. Obviously, this would be much more efficient for everyone involved. Unfortunately, it also carries some other financial obligations for the state, which was a sticking point for them. However, we were able to overcome the sort of the bigger pieces of that, those financial obligations, but they were still unable to pass it through. Eliminating funding for the SNAP incentives, I've circled back on this a few times to say it's safe. And then wanted to let you know that it is nothing is safe until the very end, right? And so in the committees of conference, the funding was attacked once again. This is for SNAP incentives are the Granite State Market Match and Double Up food bucks, where shoppers that are enrolled in SNAP are able to double their dollars at farmers markets and local grocers. And so the state pays a mere $100,000 per year to fund this program and draws down $100,000 of federal funding as well per year. So it was attacked again by one particular member that was a part of the committee of conference. And luckily, because we have folks on the inside to help us, it has remained in the budget proposal. So wanted to flag that down for you. It was a quick turnaround and unfortunately no opportunities for advocacy, but a reminder of why it's so important to have folks on the inside that will track these down for you. So still safe as of the moment. Repealing the WIC Farmers Market Nutrition Program. This also was again attacked by the committees of conference as well, in the committees of conference by one of the members there, and saved totally fine as well. This program would give a $30 benefit for every child and postpartum mother and pregnant and postpartum mother that is enrolled in WIC at local farmers markets. The original funding for this is why this is all yellow, because it's kind of a neutral outcome. The original funding for this would have implemented the program statewide. And unfortunately, they cut the funding from $300,000 a year to $30,000 a year. It still allows us to draw down some federal funding for it and therefore hopefully implement a pilot of the program in certain regions of the state. And so we're still waiting to hear from our partners at the state on what exactly the WIC Farmers Market Nutrition Program will look like, whether it will be this summer or next summer. And unfortunately, not knowing until the very end has made it really tricky for them to do much planning. So that is where that particular piece of legislation has landed so far. I am going to pause for questions. And also, Laura, I wonder if you could talk a little bit more about, I didn't mention it earlier, but the special session that the governor is calling for here.
Yeah, so I think people may know that the legislature and the governor are at odds on the budget. The governor has said she will veto the budget that they have currently passed. They are voting on their budget tomorrow. She is very clear about the veto. And so if they continue to struggle, they want to keep the government going. So she is calling for a special session because in order to get a continuing resolution out of the legislature, you need a 2/3 majority. And I think she thinks that the Democrats won't support a continuing resolution. The Republicans are calling for a continuing resolution with a 10% cut. And without 2/3, the only choice is to call for a special session where the majority party would be allowed to set the rules. So, and really unclear what what will happen. It'll be interesting to watch, but it could drag on. So stay tuned.
Are there any questions from the folks in the audience about that? I have a question, Laura, that I just read up on this morning, but I wasn't able to find anything that said what the governor's demands were in the sense of why exactly she's planning to veto.
So she is holding out for additional pension dollars for what is known as Group 2 in the state pension system, and that is firefighters and certain police officers. And it is about 1,500 people, and it works out to about $250,000 per person. So the legislature thought that was too steep. The governor feels we owe that to these folks, and that's where they're stalled.
Any questions, comments, concerns, thoughts before we move on to federal updates? Okay, scooting along. Oh, actually, before we move on to federal updates, this should actually say, as of today, June 25th, this is the advocacy that we have accomplished so far this year. 300 of you have sent more than 5,000 emails to 215 state legislators. For record, there's 424 legislators, so a little bit more than half that we've reached, and folks that know who we are and what we stand for. So thanks, Gary, for the clapping here. I can't say enough. I know that this legislative session feels hugely defeating, and we're feeling that as well. But I can't say enough how important it is that these actions have occurred and how much some of these roadblocks that we've hit have only been a few members that are holding up the process. And some of it has been misinformation, some of it has been due to really strict party lines and whipping people into votes. And so, however, I'll say that as close that we came to Medicaid direct certification in the House, especially, that missing it by one vote is absolutely incredible and is a feat that was only made possible because of the advocacy of the people in this room and the people that have taken action on our action alert. So I cannot underscore enough how important your advocacy is to making it known what it is that you see as priorities in the state budget and what that means to you. So thanks for sharing that in the chat there, Kat. Maybe sharing slides. Yes, we will share slides and notes and also a recording of this as well. And if you have not taken action before, or you want to know where to find the latest updates, it is on our website. There is a take action drop-down menu where you can select to become an advocate, and you can take action on our action alerts. And that will also give you the most up-to-date news and information about where any of the policy is. You'll see that updated before you get my weekly email if I'm sending it weekly. The advocacy updates that you've been receiving, if you're on the advocacy and policy updates email list, you'll see them slow down because there's less to update you on as the session sort of closes out. And as we have action to take at the federal level, you'll see those come out kind of as needed as we close out the session here. Also, a little plug for the Food Access Coalition policy and advocacy team. We meet every other week during the legislative session, and you'll see this is how we've been accomplishing some of the goals of the Food Access Coalition as well. And these folks want to be more involved in the policy piece of it and maybe help us create some social media posts and help with some storytelling projects, help with asking folks in their community to engage with these policies and this legislation. So that is a place where if you want to be more involved in policy, they'll also be working to decipher information that we gather from you and other community conversations about what the policy priorities will be for the next legislative session as well for the Food Access Coalition. So it is the place where a lot of decisions are made and a lot of action takes place as well. So if you'd like to join that, feel free to send me an email. Without further ado, into the federal updates. You kind of got a preview already from Laura about these cuts and what they will mean for SNAP in New Hampshire. Things that she didn't say in her update is about the broader impacts of this to also school meals. So if you're unaware, this is something I love to tell everybody and anybody that will listen, is that children that are in households that are enrolled in SNAP are directly certified for free school meals. And if you don't know, the threshold for 3 school meals is only 130% of the federal poverty level, and the threshold for SNAP is 200% of the federal poverty level. So through SNAP, we're able to feed more children in schools, which of course is a big theme for legislation this year. And furthermore, I will say that if you haven't texted, emailed, called your friends in other states yet, that might have legislators that could sway the vote here. And I'll be kind of blunt in saying Republican legislators, that this should be something that everybody is concerned about in every single state of the country, of the cost shifting. And thank you, Laura, for putting that in the chat. Also cuts benefits for refugees and other immigrants who are in the US legally here. So I'll say, continue to say that if you haven't emailed, called your friends in other states, everybody should be concerned about this, because the cost shifting is going to be nationwide and is much bigger for bigger states that have a larger SNAP population than New Hampshire does. As you know, we're quite under enrolled in New Hampshire, and other states have a larger enrollment and therefore will have a bigger total dollar bill. And what that will mean for all states is that state budgets are going to have to figure out how to make that work. And what that can look like is cutting other programs. It can look like raising taxes. It can look like a lot of other things. So the federal government is actively shifting costs to states without a mechanism to pay for these ginormous cost shifts. So anybody and everybody should be super concerned about this. Today, I will be sending out, it looks like Megan has put something in the chat. We have an action alert around SNAP cuts that folks can use anywhere nationwide if you have friends in other states who want a template to get started. Thanks so much, Megan, for sharing that resource. We also have, this is just some other stats about the cuts and what the impacts are going to be for the state of New Hampshire, both economically, jobs wise. It's a really massive impact just for the state of New Hampshire. And you can find this if you're trying to send any messages to your friends and family in other states. You can find all this information. A lot of it's available through the Center on Budget and Policy Priorities. If you're trying to make the case for them to care, and they should all care, then you can go through that link as well. But these are some pretty substantial impacts. So one way that you can get involved, and I'll be sending out an action alert today that you'll receive shortly after this meeting, is the Northeast is participating in a day of action, a SNAP day of action. You should have received my save the date last week. And one of the things that you can join in doing, it feels a little bit sometimes like we're powerless here in the state of New Hampshire, in the sense of our delegates are already doing everything they possibly can to fight to oppose these cuts. But what you can do is you can volunteer your time for phone banking, which is where you're connected through to voters in other states that have influential delegates that you can ask them to call their delegates, and you can connect them directly through to their delegates to ask them to oppose these cuts. So that's one way that you can get involved, and I'll share again in that action alert that I'll email to you all the information in order to volunteer your time to do that. Another really important piece to highlight here is that these cuts also include completely eliminating SNAP Ed. So I'd love to invite Amy if you want to talk a little bit about SNAP Ed. I did see you here. I hope you're still here.
Yes, I'm here.
Thank you.
Yeah, thanks, Tiffany. I'll just put like a quick in the chat. So they have completely eliminated SNAP Ed in the big beautiful bill text. And so I just put a few links you can learn about sort of the impacts that SNAP Ed has in New Hampshire. Some of the big things that we do is help provide leadership for some of the food access coalitions like Carroll County. We help with the school breakfast challenge through SNAP Ed that a lot of you guys are aware of. We do nutrition education all over the state, things like that. So you can check out that first link. It talks a little bit more about SNAP Ed and the program and the impacts that we have. And then the second link is a link to a national report. So really getting at like, well, how does SNAP Ed work in other states too? Our legislators here are supportive and of SNAP Ed. But again, if you know people in other states, feel free to connect them with me. I can help them learn more about how SNAP Ed works in those states and any like impacts. And then the last link is a link to contact legislators. So hopefully that is helpful.
Awesome. Thanks so much, Amy. Any questions about any of the cuts or impacts, questions that you have about talking to people about it, resources that we can help you with? Feel free to come off mute, put them in the chat. Okay. Always an amazing resource for everything federal policy and feeding people across the country is FRAC, the Food Research and Action Center. If you go to their main page, frac.org/action, or if you just click on their action page on the top menu there, it will bring you to the most latest. This is a dated screenshot of their action page, but nonetheless still has some tools and information on it as well about some of these cuts that are pending. But they'll give you also other ways that you can join in federally or nationally, national movements to try and oppose these cuts as well. And I'll bring you back also to our Become an Advocate page. We have a form on our page that is specifically designed for our to send a message to our federal delegates. The reason that it is specifically designed for our federal delegates is because it is not a please oppose this form letter. It is a thank you for supporting or working hard to oppose these cuts. And also, here is my story. Please feel free to use it. And the stories do not have to be from SNAP participants. It could be from people that are family, friends, serving SNAP participants and what these cuts would mean to those folks, or even local businesses that would be really, really impacted by SNAP cuts. Those are all things that are really important to highlight as well. And I'll invite, I know that we have a few staffers. I don't know if they have jumped off or still here. I don't have my participants up, but we have a few staffers from some of our federal delegates offices. I'd love to invite you to come off of mute and say hello and anything else that you want to say or add to the conversation. It might be, I wonder if they're, see, I know Vicky was here and then the other name is escaping me. Give it just another moment.
Tiffany, Vicky might use chat. Her microphone wasn't working if she's still on.
Okay, thank you for letting me know.
Group.
Yep. I see Aiden too from Senator Shaheen's office here. Vicky's still there. She did put, I saw her in the chat earlier say if you have anything and want to connect directly with Congresswoman Goodlander's office, and she is here for you. Just give it another second if any of the other staffers want to come off mute and say hello. Okay, I'll pass it off to Sam to talk a little bit about Medicaid matters. Go ahead, Sam.
Hi, everyone. Thanks, Tiffany. My name is Sam Burgess. I'm the Healthcare Policy Coordinator here at New Futures. I've been here for about 6 months. I come by way of the Attorney General's office, so I'm still learning a lot about healthcare policy. But it's certainly been an interesting year to get started with all of the craziness happening on the state and federal level. So a quick federal update, and this may be known to a lot here, so I apologize if I'm circling back. So on the federal level, the government is going through a budget reconciliation process. The House of Representatives passed their version of the budget. I think it was back in May, which feels like a lifetime ago at this point. But they put in a number of harmful provisions for Medicaid, including work requirements, premiums, and cost sharing. They added more administrative hoops for those who'd like to be enrolled in the program. They shortened the enrollment period, and they've cut something called provider taxes, which is going to draw down heavily on state Medicaid budget. So a number of harmful provisions. I think a lot of people who are watching this process were optimistic that the Senate, who is currently considering the budget, would moderate some of the cuts to both Medicaid and I'm sure SNAP as well. But unfortunately, they seem to have gone the other way, and they've put in more onerous provisions, which include, for instance, on the Medicaid front, harsher work requirements, and they've cut provider taxes even more steeply than was proposed in the House. So the Senate's likely going to have a tough road to hoe. If they continue on with these harsher cuts, they have a very, very shaky majority in the House at the moment, given a lot of the cuts that are on the table. I think it's also important to note that something that doesn't get a lot of airtime is the reconciliation bill is really, really bad for healthcare in our country, not only because of the Medicaid cuts. There's also something called the enhanced premium tax credits for the ACA marketplace plans that are not going to receive renewals. That's huge for New Hampshire and for other states as well. That means I think in New Hampshire, 47,000 of the 70,000 people on the exchange currently have some type of tax credit subsidy that makes their healthcare plan affordable. So we're going to have a ton of low income and even middle income grant staters who are going to have largely increased premiums. It's a 1/3 cut in enrollment on the marketplace that's at risk nationally. So it's proportionally a much bigger enrollment and coverage loss than those projected for Medicaid. So we're trying, along with a lot of our partner organizations, to sound the alarm, and through our Medicaid Matters group, which is a number of coalitions, groups coming together to urge lawmakers federally, but also here at the state, to cut back on these harmful Medicaid cuts they're currently contemplating. But yeah, there's plenty of bad things we're looking at. We're following the situation closely with our group. If you have any interest in joining the Medicaid Matters group, please reach out. I think, as someone else mentioned, the Senate parliamentarian right now also has some thoughts on Medicaid cuts. So hopefully that may slow the process a little bit. But we're just watching and trying to do what we can to advocate as the process continues. But if anyone has any questions or would like to connect over Medicaid offline, please reach out. Thank you.
Any questions for Sam? All right. So with that concludes all of our policy updates. We're going to walk into checking in about some Food Access Coalition goals, just a 6-month progress check-in, but I'll hand it off to Tara to talk more about that.
Thanks, Tiffany. Yeah, we just thought, we're 6 months in. It'd be great to kind of do a little check-in and share updates on how we're doing. If you'll go to the next slide. Thank you. One of our goals and priorities for 2025 was to plan and host the Nutrition Equity Summit in the spring of 2026. However, we, just with everything that is happening and funding challenges, we have made the decision to not host a summit in the spring of 2026. However, we've talked with some partners about potentially kind of joining forces with some statewide conferences that are happening next year. So there's some discussion around that so that there could still be some like professional development and networking opportunities that would kind of be part of a summit. It just won't be a formal one as we did this past year. And also, kind of in lieu of the summit, we're hoping that to try to fill some of those gaps, that working with the local and regional coalitions to host celebrations in October. There'll be very community-led events to celebrate the work that's being done within coalitions and within communities. Really want to preface, though, it's in the very early stages of planning, but we do have Julie Day here, who is part of the Capital Area Food Access Coalition, and she is going to talk about some of the coalition's plans that are in the works. So I'll pass it over to her.
Thanks, Tara. So I'm the co-facilitator. Ouch. Sorry, my cat is driving me crazy. Okay, he's gone now. So I'm the co-facilitator for CAFA along with Joanne. And we've decided to do our event in the morning during our normally scheduled program, but maybe make it a little bit longer. So October 9th, and maybe doing a breakfast. This is all still in the works, so we don't have anything nailed down quite yet, but we're looking to really celebrate the work that we have done over the last year, and celebrate the food pantries in the area, possibly Jennings Drive, Christ the King, and NHTI. Really talking about the community fridge, which we are hoping that we will have a location by then, and celebrating that. Celebrating the food pantry over at Broken Ground, and then also highlighting the Leah's Pantry through UNH and talking about that, and then having a follow-up educational training with community members, anybody that wants to come to do the full training, with the date to follow. So we'll figure that out when it comes. We know that our partners are really busy in October. There's a lot of activities and events already happening, and that's why we decided to do our regular morning event. But like I said, we're hoping to do a breakfast, invite some community members that may not normally come, some legislators, Hunger Solutions will be there to do a brief overview, and really it will be a celebration. So that's what I have. Joanne, did I miss anything?
Sorry, you got it. You nailed it. That what we have sort of in the works. We just need to really dot some I's and cross some T's and talk to some of our partners.
So that's what we have for you so far.
Thanks so much for sharing, Julie and Joanne.
Thank you.
And be on the lookout for the celebrations as across the state as they become a little more developed. Next, our priority 2 and priority 4 goals for 2025 was really to work and recruit some regional policy liaisons and have some aligned messaging. And so, how we've kind of met that is working with our NHFAC policy and advocacy team to collect different social media posts from various partners to raise awareness about hunger in schools and the work being done there. And we have policy liaisons in each of our coalitions. So doing a good job there of kind of bridging that gap. And then we actually have Jackie, who is a part of the Lakes region um, coalition, who couldn't be here today, but we have an example of one way that she helped to create a video and awareness of hunger happening in schools. So I'll let Tiffany play that video.
My name is Jackie McGettigan, and I have worked in New Hampshire school systems for over 30 years. I am currently the Family and Student Support Liaison for the Winnisquam Regional School District. Let me tell you what food insecurity actually looks like in our district. This is what we see. Each week, thanks to the generosity of a local organization, over 100 students are sent home on Fridays with a bag of food to help replace the meals they would have received at school. We sometimes see children emptying the classroom snack fruit bowl into their backpacks so they will have something to bring home to their families at the end of the day. For some students, the lunch they receive at school is the last meal they eat until they return for breakfast the following day. Approximately 40% of our students qualify for free or reduced meals. Many of these students automatically qualify, meaning they are direct certified because their families are already receiving SNAP or TANF benefits, or they are experiencing homelessness. The remaining students must submit an application to determine eligibility. Of the applications received, about 8 to 10%, which represents roughly 20 to 25 students, are not found eligible because their family income is slightly above the eligibility requirement. We also have no way of knowing how many families do not even attempt the application because they have already seen the eligibility requirements and assume they will not qualify. These are hardworking families trying to do the best they can for their children, but their efforts prevent their students from receiving free meals at school. The amendment to HB 2 for Medicaid direct certification would help these families in several ways. First of all, it would eliminate the additional school meals application process for families who qualify for Medicaid. Let's support Medicaid direct certification. It is a simple way to ensure that more New Hampshire students are fed and ready to learn. Thank you. Let's support.
That's our local celebrity right there. Great video that she got to help put together. And then we wanted to highlight our priority 3, which was to, collect and share stories from individuals as well as designing an assessment. So first, the New Hampshire Food Access Coalition Policy and Advocacy Team, they have partnered with the Campaign for a Family Friendly Economy to do a story collecting project. I don't think they were able to make the call today, but they're working to collect stories to help meet this goal. And then also wanted to highlight that the Food Access Coalition Nutrition Access and Research Network is beginning the very, very early stages of designing an assessment. And I think we're actually meeting later today. So there will be more to come on that, but just kind of giving you an idea of kind of where we are um, in the year with some of our goals. But we can pause here for any questions anyone has, any comments, open it up for that. All right. Well, I'll turn it back over to Tiffany and she can close us out. We might be finishing up a little early today.
Oh my gosh, we made it on time today. Normally we're like 20 minutes behind on our schedule. So, which is great. Love to give people back time in their day. So that is all that we have for you today. We had some awesome initiatives that have already kind of been started. A lot of the focus has been on the policy and advocacy for the first half of the year during the legislative session. And so we'll see those results after the legislative session has ended. We are working on, of course, you all have been following along and you've seen the results as they've come out, but we are working on how to communicate sort of the final version of all of the policy priorities that we pursued this legislative session, and then also looking towards the next legislative session on what we think will be feasible, possible, given that we'll be working in the same legislature with the same folks predominantly. Some folks might leave here or there, but mostly we'll be working with all the same folks. So we'll be working hard to assess that and also hosting some community conversations to make sure that we don't have any blind spots and the policies that we'll be pursuing are in line with the community partners' needs and collaboration there. So that's where we are for the year, and that's all I have for you today. So I would invite if anybody has any questions or closing remarks to add, otherwise we'll send you off. All right, seeing none. Awesome. Thanks so much, everybody. And I'll give you 15 minutes back in your day. Hooray. We'll see y'all later.
Thank you.
Thanks,
Bye.
y'all. Take care.